My name is Maddie and I'm a general dentist with a special interest in early intervention orthodontics. So my background as a dentist, I studied at Griffith University on the Gold Coast. When I was at uni, I really thought that I would become an oral surgeon. That's where my interest was. When I started looking for a job, I came across a position with myofunctional research. They were advertising a position for a dentist in their myobrace clinics. In researching that position, I came across a whole field of orthodontics that I did not know existed. When I was at uni, I was taught, in terms of orthodontics, how to refer a patient to an orthodontist. I was taught how to identify crowding and a Class 2 and a Class 3 malocclusion, and how to fill out a referral form. We were not taught about options beyond braces, really. I realised that there was a lot more possibilities in terms of early intervention orthodontics and myofunctional orthodontics that I just had no idea about. So myofunctional orthodontics is different to general dentistry in that really we're looking beyond the teeth. As a general dentist, we tend to focus heavily on the teeth and inside the mouth, and we forget sometimes that those teeth are attached to a head and attached to a body. We're looking at things such as breathing disorders, which is largely ignored in general dentistry. We're looking at the quality of a patient's sleep and screening for sleep disorders, looking at a child's overall health and their growth and development. And we are treating patients at an age where typically really all we would do would be to treat dental caries, provide oral hygiene instruction, maybe do the odd pulpotomy or pulpectomy. With myofunctional orthodontics, we want to be treating these problems as early as we identify them. So our patient base, we have 3-year-olds, we have 5-year-olds, all the way up to 10, 15-year-olds. But what we want to be doing is identifying these problems early and preventing more serious problems from developing down the track, such as issues with sleep apnea and more serious malocclusion. So some of the main benefits that patients gain from myofunctional orthodontic treatment are improvements in sleep breathing. I think that's probably the first thing that parents come back and say, Johnny's no longer snoring, or no longer grinding, or that sort of thing. We see improvements in their behaviour and their concentration. Of course, we see improvements in their facial development, development of the jaws. We see improvements in their self-esteem as well, which is huge. And so being able to see a child flourish in that way is really, really rewarding. So the future of myofunctional orthodontics among dentists, I hope it becomes a lot more mainstream. I would like to see it become part of university curricula, because I think without that, it's something that most general dentists don't really know about. We still have parents come in on a daily basis accusing the general dentist of having not mentioned this earlier. They say things like, Johnny's been going to the general dentist since he was 2, how come they never mentioned this to us? And you can't blame the general dentist. If I was to point the finger at anyone, I'd blame the university for not teaching this sort of thing to us. What I would say to other practitioners considering to adopt these techniques is you really have nothing to lose. There's a whole field of orthodontics out there that doesn't necessarily exist in the textbooks. That's not to say that it's not evidence-based. It's hugely evidence-based, but we really have to sort of step out of our comfort zone and look at other treatment options that are available. Take that leap of faith. When I started using it myself and I saw the results born out of my own hands, it was undeniable. I couldn't really go back. There's a lot of support available. Myofunctional research provides a lot of support to first-timers or even experienced practitioners, and I know that you will not regret it.